Today, I would like to review an important recent publication in the Laryngoscope Journal, which was published last year in 2024 by Professor Hyung Tae-Kim. Dr. Kim describes his updated results and techniques of his important gender-affirming vocal feminization surgery called vocal fold shortening and anterior commissure retrodisplacement surgery. His update describes many important aspects, both overall of his technique, as well as some important revisions of his initial description of how he does things. Now, honestly, this is mainly important for surgeons like myself. These updates play a critical role in terms of surgical planning and making sure that the outcomes are as good and as optimal as we can achieve. What are some of the things that Dr. Kim describes in this most recent updates? He describes using the revised technique results in a dramatic increase in terms of the pitch elevation. He goes as high as an average of 204 hertz in terms of the use of the new technique. Now, let's talk about what this new technique is, this so-called type 2 vocal fold shortening surgery. And it really is described, and this is something that we're doing as well, this is described to be pulling the vocal cord stitches into the front part of the voice box. Really, when we think about the voice box, we have the thyroid cartilage, and underneath it is the cricoid cartilage. And the cricoid cartilage, which serves as the foundation of the voice box, it has a small film or a covering or capsule. We call it the perichondrium. And this film can actually be pretty strong and hold a suture. It's important when suturing the vocal cord ligaments, which is why Dr. Kim's technique is vastly different than the Wendler's glottoplasty. When suturing, we want to not just drive underneath the vocal cord, we want to incorporate that film or what's called the perichondrial layer of the cricoid cartilage. So what we see then is that when done appropriately, the stitches not only bind the ligament or the forward part of the vocal cords together, but what we see is almost like a puckering. And Dr. Kim shows us, and is also seen in some of our recent surgical photos as well. You see not only that there's a binding of the vocal cord ligaments, but there's also a pulling down of that soft tissue really down and forward into that cricoid cartilage. With this revised technique, not only does Dr. Kim describe an increase in the higher level of the voice elevation, but we also are seeing a better or optimal cutting off of the lower aspect of the voice pitch. And in fact, when we think about what really is best matched up, or what we call correlated with how patients see their own outcomes, the bottom range is actually more important in terms of achieving optimal gender health, as opposed to really getting the upper part as high as it can be. Both obviously are very important, but what we're seeing with this new technique is a maintenance of the vocal range. Some other vocal surgeries for gender-affirming care really just cuts off the bottom range without increasing the overall range. And so what we're seeing here is a true reconstruction of the voice box and really continually to improve our own outcome. In that way, Dr. Kim is also describing that there is improved patient outcomes in this publication, this journal. We are looking at the data. We're constantly reevaluating, are these surgeries the correct ones? And we can only do that with following the science and the data. Dr. Kim's data here shows that with this new technique, he is demonstrating increased patient satisfaction, which is really a critical component of how we achieve success in gender-affirming care.